Hello, everyone. Welcome to the Self-Care Forum podcast. My name is Dr. Cedrick, your host for the hour. We bring you knowledge to empower you and address the root cause of disease. Our goal is simple. It's to interest you in the care of the human frame, in diet, and in the cause and prevention of disease. Today, we are joined by none other than Dr. Lola Ashaye. Dr. Lola Ashaye is a board-certified family doctor, and she's the owner of InTouch Primary Care in Sugar Land, Texas, a Houston suburb. She's been practicing for about 15 years, and she's very passionate about preventing chronic health conditions. This is why she has a direct primary care practice that helps patients not only achieve, but consistently maintain a healthy lifestyle while lowering their cost of care. Dr. Ashaye, thank you so much for joining us here on the Self-Care Forum podcast. How are you doing today?
I'm doing great. Thank you for having me.
Well, the pleasure's all mine. Thank you so much for coming. So we have a little tradition here on this podcast. We always like to know a little bit about our guest. And so for you, I'd like to know just a little bit about your background. What inspired you to pursue the path that you've taken in life? What inspired you to pursue medicine in the first place?
Yeah, so growing up, I actually wanted to be a physical therapist like my mom. So that's what I used to tell everybody. But I honestly didn't really know for sure. I was just saying, whatever came to mind. But towards the end of high school, so I'm Nigerian, so having African parents, they wanted to know exactly what I was going to be doing with their money in college. So they pretty much were like, well, if you're not sure, then maybe you stay home for one more year, go to a community college until you know what you want to do, that type of thing. And that was not my plan, right? I was eager to leave home and have my independence and all of that. So I was essentially forced to think about it deeply. And but the main thing that really helped was, and I tell a lot of the young people now, the high school students, was at the time. And shout out to my high school counselor, Lori Vogt. She lined up a few shadowing opportunities for me. And I got to shadow a gynecologist. And I still remember that experience. It was just the doctor-patient relationship. I wasn't there very long, but I got that opportunity to watch a doctor-patient interaction. And I was really just drawn to it. I mean, it was this lady, she had known this doctor for years. They were very comfortable talking to each other. It was such a genuine, comfortable conversation. He wanted to help her. She was very just relaxed. And that interaction really made an impression on me. And that was the first time that I actually considered medicine as an option. And over the next 4 years in college, I went to University of Michigan. I would change my mind here and there. I was on the pre-med course, but once in a while, I'd be like, maybe I can do something else. But I had a job in my fourth year, and it was a desk job at the public health department. And after doing that for one summer, it was clear that I was not cut out to sit behind a desk. I mean, I was so bored. So that was when I was like, okay, interacting with people is definitely my thing, and medicine, the main attraction for me to medicine.
Wow, very interesting background there. Thank you for sharing. And so how long have you been a physician at this point?
So graduated from medical school, and I always mix up dates, but 2007 was when I graduated from medical school. So after that, I had a 3-year residency, and then that ended in 2010. And then now, and then I've been, I've worked at various places since then.
Mm-hmm. Now, what's interesting is that you own your own practice, InTouch Primary Care, correct?
That's correct.
What was the transition like, or rather, to rephrase it, instead of working for an established practice, what made you decide to start your own with InTouch Primary Care?
Yeah, so it's funny. I was thinking about that a few days ago, and I had worked in a traditional care system for over 10 years. So basically, what a regular practice. And I worked in different settings throughout that time period, and what I started to notice, I started to see a lot of flaws in the system, and I realized it was a systemic thing that no matter where I went, I was probably going to face those challenges. And the main thing that I noted was it seemed like the goal of the doctor and the goal of the establishment were not the same. So I'll give a few examples. For example, there was a constant push to see more and more patients in less and less time. So patients spent less time with the doctor. We doctors were hurrying through appointments, and people don't always stop to think about why. And I'm going to ask you this, Dr. Cedrick, which do you think insurance will reimburse better? Seeing 4 patients in 1 hour or seeing 1 patient in 1 hour?
Well, you'll make more money seeing 4 patients in 1 hour.
Right. So that's why. So the reason that it's set up the way it is because, you know, these places need to survive. So they survive by maximizing the number of patients that the doctor can see in a specific time. So that also made it more difficult for patients to make appointments because the goal was always to fill the schedule, right? So that was the first thing. There was the system, the way it was set up was incentivizing doctors, the practice to see more patients in less and less time. So that was one thing. The second thing was I certainly didn't have time to follow up on the care that I was delivering or to be proactive at all. So most of my time was spent just, making sure that the documentation followed all the rules that the insurance had put in place, because that was the only way we get reimbursed for that visit. So that was a big deal. So instead of spending time, following up and all of that kind of stuff, we were bogged down a lot with paperwork, trying to make sure that whatever time, the little time we did spend with a patient was actually going to be reimbursed. So that was another thing. But I think what was most upsetting for me was when I would work with a patient successfully for about 2 3 years. We lowered their A1C. We're doing great. Their diabetes is controlled. Everybody's feeling good. And then maybe I don't see them for a few months, and I'm like, I haven't seen this person. That's if I notice, right? I haven't seen this because I'm so busy, right? But if I happen to know I haven't seen this patient in 3 months, what's really going on? And I decide to call them, and then I find out, oh, by the way, I changed jobs, and so I've lost my insurance, or I lost my insurance, or my insurance changed. You guys no longer take it, and so I was told I couldn't see you anymore. So it just felt like, what was the point of all that? Like, you spent all this time, all this energy getting to a patient to a certain point, and then because of something like that, they couldn't see you anymore. And I'd seen those patients from other doctors, right, that will come to me after they had successfully maybe, controlled their diabetes. But by the time they got to me, many times it was months or years, right? And so it almost always felt like we're starting over, because the truth is, when a patient finds a doctor that they like and they lose that doctor, it takes them time to find another doctor that they like and trust. And that time, the health suffers. So it always felt like you were catching up. You were always reacting to something. And that was quite frustrating and actually really sad. So those were the things that really made it difficult for me in that system. So it just felt like there were so many barriers, and regardless of where I went, that was going to be an issue. So I decided I needed my own, right? So I didn't want to rush through patients. I didn't want to hurry them away. I wanted to be able to follow up with them. I wanted to know that the plan we agreed upon was working or needed to be adjusted. I wanted it to be easy for them to reach me so that they can prevent serious conditions instead of delaying care. And because we have a membership model, it allows us to be able to do all these things. I enjoy getting to know my patients now. I enjoy taking care of them over time. I'm not scared that when, a life change is going to completely disrupt our care. It's such a special relationship. And My patients now, I feel like we can achieve, but also maintain a healthy lifestyle and actually prevent health conditions so that they can actually enjoy all they work so hard for. So it's a big difference.
And that's very enlightening to see the inner workings of, the patient physician relationship and, some of the factors such as insurance prompting patients to look for a new doctor. I'm sure it's common. I'm sure it's a very common occurrence, but when you're outside of that system, you really don't know, just how significant it is. Which brings us to the next thing that I wanted to talk a little bit about, because with your practice, you have something called direct primary care. Now, for those who may not be familiar with this term, it's actually different than what most of us use when we go in and see our doctors. Direct primary care is a model of care that usually removes the need for third-party insurance. And so as someone who does utilize that model of care, what are some of the benefits that you see and how do your patients like it?
Yeah, absolutely. So I had mentioned that unfortunately, third-party insurers have gotten in the way of delivering quality care. And this is especially true for primary care. So I tell people, having health insurance is not the same as having health care these days, especially because a lot of people end up still paying a lot out of pocket, whether or not they have insurance, because many people have a deductible, and the deductible is usually pretty high. And so even with insurance, you still end up paying. But what you're paying for a lot of times is not great. You're paying for, you still don't get access to see a doctor. And a lot of people that actually have insurance, especially those that have high deductibles, end up not using their insurance as often. And I saw that happen a lot too, where people will have insurance, but they had a high deductible. So they knew if they came in, they had to pay out of pocket first. And they didn't know what that cost was going to be. So they wouldn't come in. They would delay their care until maybe something big happened and they met their deductible, and then their insurance was going to pay. So it was like backfiring in a sense. So let me briefly explain how the membership model works with direct primary care. So the patient pays a flat membership fee. So this flat fee gives them direct access to the doctor. The rate depends on the practice, but in primary care, that rate could range from like $75 to $125 a month, depending on the practice. And that's it. So they have that flat monthly fee, typically paid annually, or it could be paid month to month too. And that gives them access to as many visits as they need. We don't process their insurance at all, so it makes it much less complicated. So the benefits to the patient, number one, we free up time. So that time I talked about that we spend documenting, we can actually spend that time really getting to know the patient. Visits are no longer hurried. So typically my visits now last 30 minutes to an hour. I have time to discuss preventative care and to be proactive about their care. I have time to in the schedule now. So we offer our patients same or next business day appointments. So the barrier of not coming in due to inconvenience is removed. So that's one way it benefits them. The second way it benefits is because it's a flat fee. It covers as many visits as needed. So that barrier of cost where they're like, oh, I'm not sure how much they're going to charge me this time if I come in, is gone. So we're actually incentivizing people to come in because now they can come in as many times as they want, as long as, they have with the flat fee, with the membership. And so that uncertainty about cost is removed. And then the flat fee also gives them access to things that are beneficial for patient care that is typically not covered by insurance. So for example, insurance does not reimburse doctors to talk to patients over the phone. And so people may wonder when they call their doctor for what they think might be a simple reason why their doctor doesn't just get on the phone and talk to them. The reason is the doctor cannot do that for every single patient because they don't get reimbursed at all for that.
Right. Time is money.
Um, time is money, right? So they can't, there's no, that is not sustainable. So what are they going to ask you to do? Come in, right? But what ends up happening, people wouldn't come in if it's inconvenient, and they might diagnose and self-treat and get into trouble that way. So they're essentially delaying care because of the fact that they don't have easy access to the doctor, right? So with our membership, they have easy access to the doctor. They can call, text, email us directly in between their visits. And that makes a big difference because we can quickly attend to their needs and they don't have to delay care. And I think the biggest thing for me too is now when a patient loses their insurance or if they change jobs and they no longer have to leave the practice for that reason. I mean, of course, there might be other things that could influence them, but it wouldn't be, it's usually their choice. It's not, something out of their control that causes them to lose their doctor. So it really gives us the opportunity to help them maintain a healthy lifestyle long term, and that's our goal.
And so I want to pick your brain a little bit about, the healthy lifestyle, because it seems like you have a little bit more freedom and time to really get deep and get in depth with patients, which is a rarity in the conventional model, in the traditional model, because again, they say the average doctor's visit is only about 15 minutes. You only have 15 minutes of contact between you, the patient, and the doctor, right? And so there's not a whole lot that you can do or that the doctor can talk to you about in that time frame, right? Because there's just so much that's happened. You can't cover it all in 15 minutes. So I want to talk a little bit about your practice and how you guys differ. The conventional doctor's visit, it involves seeing a patient, running tests, giving them a prescription. That's generally how it happens. But it sounds to me that you guys focus on lifestyle medicine, actually talking to patients about, lifestyle, diet and nutrition, that sort of thing. So in your practice and in your opinion, are some of the advantages of this application of lifestyle medicine?
Yes, so lifestyle medicine is actually something I decided to study in addition to primary care. So not all primary care doctors practice lifestyle medicine, as it requires additional training too.
Mm-hmm.
So, but the idea of lifestyle medicine is to use lifestyle approaches not only to prevent, but also to treat and often reverse chronic diseases and to help the patients sustain healthy life and healthy behaviors. So the way it benefits the patient is that we're able to talk in depth, like you talked about the nutrition that will help them to achieve, a healthy lifestyle. We're able to talk in depth about physical therapy, adequate sleep, stress reduction, emotional well-being, avoiding risky substances, and other evidence-based non-drug methods. So we're looking at the whole patient, we're looking at their risks, and then we're coming up with goals to prevent. So we're trying to be proactive instead of waiting until something comes up. And in lifestyle medicine, the patient is a very active partner because the patient is the one that has to do the work. Right. So in primary care, right, I mean, there is, you talk about it a little bit, but with lifestyle medicine, you're really, talking about it. And patients can go as far as they want in, doing the things that need to be done. But our job is just to encourage them and move them further and further in that continuum so that they can, reach their goal, their healthy lifestyle goal. So we aim for patients that are truly motivated to significantly lower their medications, and in some cases actually completely get off medications. So yeah, exactly. And it fits really well with the goal of preventing health conditions and maintaining healthy lifestyle long term for me. So I jumped right at, I really, really like talking about lifestyle medicine.
And I think it's really important that this be heard and this be known, because I know for a fact that, for some people, when you tell them that, listen, you can reverse these diseases, these are lifestyle diseases, they kind of look at you like you've got a third eye on your forehead, right? Like nobody else talks about this, right? But I think the message And this is really the motivation behind this podcast. The message that you can reverse these lifestyle diseases. You don't have to take these medications for the rest of your life, but it takes effort. It takes effort on a doctor's part, but ultimately it's your role, because it's about the choices you make. A doctor can tell you everything, till they're blue in the face. But if you go back and you continue to live the way you live, eat the things you eat, drink the things you drink, then you can't blame anybody for your predicament, right? And so that's why we called this podcast the Self-Care Forum, because it's about empowering individuals to understand the power of self-care. You are not just a bystander in your healthcare, but you're the active player. It's really good if you can find a doctor that's willing to steer you in the right direction. But ultimately, you're the one that is steering your ship, which is your body. Okay. And so I love to hear, the message of being proactive with your health, the ability to reverse these medications, especially because they are lifestyle medicines. And so that takes me to my next question, because right now in the United States, if you were to line up 10 people, 6 of them are living with a chronic disease. It could be diabetes, high blood pressure, acid reflux, arthritis, you name it. If you align 10 people, 6 of them would have a chronic disease. Interestingly enough, 4 out of 10 of them have 2 or more chronic diseases. So in my book, Self-Care Advocate, I talk about how the traditional healthcare system that we have, it has done a really poor job of stopping this growing trend. And the trend is the growing number of Americans with chronic diseases, right? So how do you usually approach this issue with your patients?
Yeah, so I think, the trend is because of a combination of things, which I already touched on already, right? The fact that it's so difficult for people to get easy access to care. So I think the direct primary care model really helps with this issue by removing some of those barriers, as we discussed earlier, and incentivizing people to actually seek care instead of being overwhelmed or, just the whole process is such a hassle that they just avoid it in general. So I think that is a big part of it. The other part, I think that for me, how I really try to talk to patients about lifestyle changes, because that's really what's sustainable. Yes, there are times that medications are helpful depending on the condition, but I think many people can actually get off medications if they were to practice the lifestyle changes that are, I talked about. Part of it, though, honestly, is I think there's just so much stuff out there that's confusing, and people don't often have time they don't understand how to do it. They need someone to kind of show them step by step. And it's a combination of things that needs to happen, and it's not a quick process. It's it takes time, and so that's the thing. But it is the most cost-effective way. Going the lifestyle medicine route is the most cost-effective way to deal with health.
In 2020 alone, we spent somewhere around $4.1 trillion in healthcare, and I believe 75% of it was due to preventable chronic diseases. So the bulk of our healthcare spending is spent treating the consequences of mismanagement, right? It's spent treating symptoms, and that trend is only ever going up. And so I think what I deduce from that is that there is just this large level of ignorance from the general population about what is within their power to do to reduce that that financial burden, not only on themselves, but on the system, the healthcare system as a whole. So I thank you for shedding some light on that. So I want to dig into a little bit on some of these chronic diseases. So the number one cause of death in America today is heart disease. As a matter of fact, 45%, so almost half of all the adults in America, have hypertension. In other words, high blood pressure. Many of them don't actually know they have high blood pressure. Unfortunately, some sort of hypertensive crisis or maybe a trip to the emergency room will often reveal to someone that, hey, you've had high blood pressure. You've just never, you've been ignoring it, or you just didn't know. So it's not something that everybody seems to know their status on. But what advice would you give someone who was currently living with high blood pressure? Because the common advice is, hey, reduce salt, take your drug or whatever. But what advice would you give them using lifestyle medicine?
Yeah, so before I go into that, I do want to say that, one of the reasons people don't know they have high blood pressure is because people don't generally have symptoms. So I just want to put that out there, that the fact that you feel fine doesn't mean you are fine. You have to check. So a lot of people don't know because they don't check. They say they feel fine, so they never go into the doctor, and so they never find out. So it's so important, regardless of how you feel, to still go ahead and go get checked out and make sure that you actually are fine. Because even though you feel fine, your blood pressure could be destroying your heart and kidneys and everything while you feel perfectly fine. So it takes time before you start to feel bad. But in terms of someone who knows they have high blood pressure, I think one of the things that my approach is a stepwise approach. First, I look at their risk, and based on their risks, I will processed foods account for majority of the American diet. And these foods have chemicals that typically negatively affect health, including heart health. And I think there's a lot of confusion about what a healthy diet really is, or what even food is. So eating whole foods means eating food that comes directly from the ground. So if you can imagine going outside and plucking something off the tree or digging something from the earth, that's whole food. So the more of that you can eat in general, the better. So instead of processed foods, if you're eating something that you can't really figure out how it was made, that's typically ultra processed food. So the less of that you eat, generally, the better off you are. So usually with people that have high blood pressure or anything that's affecting the heart, a heart healthy diet will be, if you imagine a plate, half of that plate should have fruits and vegetables. The other quarter should have whole grains, so like brown rice, whole bread, things like that. And then the other quarter should have legumes, so like beans and nuts and things like that. So if you can imagine a plate like that, many of us know that that's not what our plates look like, right? It's very different. And again, making that change is usually not like, oh, I'm going to start doing that tomorrow. It's a process, because there's a lot of mindset stuff that also need to be addressed. So it's, a lot of times step by step, trying to guide the person through that process to get to where they need to be.
Thank you for that, doctor. Let's dig a little deeper with another chronic disease, if you will. This time I want to dig into diabetes. So at present, about 10% of the population is diabetic. 95% of them are type 2 diabetic. But interestingly enough, and this is actually quite scary, there's a further 96 million adults, that's 1 in 3 adults in the country, that are said to be pre-diabetic. Okay, so 10% right now are diabetic. Another 96 million are pre-diabetic, which means they will likely become diabetic in the next couple of years if nothing changes. So I ask you, Dr. Ashaye, what can we do right now to reduce the risk of developing diabetes? And how do we really know whether we are pre-diabetic or not? Is it like high blood pressure where there are no symptoms, or what?
Yeah, again, it is like high blood pressure, where in the pre-diabetic range, most people have no idea that they have diabetes because they feel fine. Even early diabetes, most times when we see people that have symptoms of diabetes, actually their A1C is like 9 or 10. So that's, by then, there's already been permanent organ damage. So that's the scary part about a lot of the chronic illnesses is because people don't have symptoms. It just, they think they're fine, but until we check, we don't know. So nutrition is so important with preventing diabetes. And I think prediabetes needs to be taken a lot more seriously because that's an opportunity to prevent diabetes. It's much easier to reverse when you're in the pre-diabetic range versus when you're in the diabetic range. So that's the first thing. And for people that have diabetes or prediabetes, what I recommend is significantly lowering their saturated fat intake. So saturated fat that comes from animal fat, especially, because that causes a lot of inflammation in the body, which causes insulin resistance. And there's a lot of technical stuff I can get into there, but just to be clear about what people actually need to do is, if I usually will start with encouraging them to lower as much animal protein and replace it with plant protein as much as possible. And again, do your best, but start that process. And then for carbs, substitute carbs with whole grain options. So like brown rice instead of white rice, whole oats, whole grain bread, tortillas, cereal, things like that. So start to make that substitution. And then if you remember our plate, where majority of your plate is fruits and vegetables, food that you can actually get directly from the ground or pluck from a tree. And also, the other quarter being carbs, but whole grain, whole carbs, and then the other being legumes. That holds true for prediabetes and diabetes as well. So there are many things that we could work on, but typically nutrition, the diet is where you get the greatest benefit. So, and that, so that's typically where I start.
Thank you for that. It sounds to me, and this is a commonly reoccurring theme, no matter who I interview, it sounds to me that nutrition is fundamentally crucial to maintaining optimal health. Can we say that?
Absolutely. Nutrition is like the foundation.
Mm-hmm. Yeah. Yes. So, next time I see some of the folks in the audience and, they're eating the wrong stuff, I can call them out on it. But, what other lifestyle factors should we take? Should we take action towards reducing or changing due to their negative impacts on our health? You talked a little bit about, you talked a lot of it about eating healthily, and you gave us examples of some, foods to consume more of. But what else? What other lifestyle factors should we take into account if we wanted to reduce our risk of a chronic disease?
Sure. And before I go into that, I would want to say, many people already know many of these things to an extent. They know fruits and vegetables are healthy, for example, even if they're not aware about exactly what to eat and how much. But many people know these things. A lot of it, though, is how to getting people to actually do what they know. And that's what I mean by just you need someone to kind of guide you through that process a lot of times. And but so that's important too, like figuring out why, even though you know what to do, you're not doing it, and helping you along that journey. And then in terms of other things that are beneficial, physical activity is also very important. And for people that are just starting out, I always say, start out small. Don't start out with 1 hour every day, because more than likely it's not sustainable for most people. When you're starting anything new, try to think about it in terms of, can I continue to do this for the next 2 to 3 years? If the answer is no, then you're better off just waiting and picking something that you can actually do consistently. So with physical activity, my advice is start out with 10 minutes and try to do 10 minutes habitually, 5 times a week, 3 times a week, whatever it is you decide. It's better to do it every day, though, because that puts you in a habit, and you're more likely to do it when you make a habit of it. But start out small and then build up to it. The other thing that's really important is sleep, getting adequate sleep. And sleep is really not just to rest, it's actually to heal your body and to repair your body. So
Right.
prioritizing sleep is actually really important. And one of the things that I do is I set an alarm on my phone to remind me to go to sleep. So not just to wake up, but it reminds me to start winding down so that I need to go to bed. And just doing things in your life to prioritize sleep is also important. And then the other thing is avoiding substances like cigarette smoke completely, because that is definitely the one of the fastest ways to become unhealthy is by smoking. And then also by limiting alcohol is also necessary. So there are many different things, but those are probably the major things that other things that we can work on.
It's amazing, doctor, that, as you said, people know this. People generally know what to do. They know what to eat. But the practice of actually doing it is very difficult. Is it that we lack some sort of coach or someone to hold our hands or keep us accountable? Is that a fact? Am I onto something there?
Yeah, I think it's a combination of things, right? And that's why a lot of times when I talk to my patients about eating healthy, they use their kids as the issue. Oh, but my kids like to eat this, this, and this. So we have it at home because I say if you don't have it at home, you're not going to eat it, right? But the truth is that's how we're raised a lot of times. So you don't it's really hard. You've been raised a certain way about food is cultural too, so there's a lot of things that go into changing your diet. It's not as easy as just, oh, you need to do this, right? And so people we need to kind of get into what it is that is in the way of that to be able to make the most change. So when people use their children as an excuse, they say, well, they need to start to learn how to eat healthy now so that they don't have the problems that you have, right now. So you don't need to use them as an excuse for buying the potato chips and the ice cream and all of that, right? So you have to, I think it's a whole cultural shift that needs to happen. And but people can make really a big difference with just small changes over time. So you don't have to completely, not eat anything you like. That's not what we're talking about. But I always come from the perspective of what can you add? What can you add to your diet? That's how I come, because when you start trying to take things away, it's difficult. But if you start thinking about what can I add that that I don't already eat? Can I add some broccoli or some carrots or some fruits or some and that people are much more willing to take that approach. So there are some tricks that we have to play on our mind for it to happen.
Yeah, yeah. Well, speaking of people who know what to do but don't, I want to pick your brain and ask you about smoking. Right? I mean, we've known for decades, right, that it's considered harmful. Yet to this day, millions of people still smoke. We attribute it to the substance in cigarettes called nicotine. It's an addicting substance. For those who are addicted to nicotine, how can they overcome? What lifestyle habits, what do you recommend for them to actually overcome the chemically induced nicotine addiction?
Right. Yeah. So smoking, like many other addictions, has to do with mindset too, right? And a big part of quitting is having a good, solid plan. And plan involves, recognizing what the triggers are,
Mhm.
recognizing what dangerous situations are. So, for example, if you know that you tend to smoke when you go out with your friends, we have to have a plan for that, right? So ahead of time, not not when you're about to go out. And that way we can say, okay, do we really need to go out with these friends? Do we need new friends? No, but but we really need to start thinking about other ways to what else are we going to do instead? Like when everybody's smoking, what are we going to do instead of smoking? So we have to really have a solid plan in place, and then avoiding as much of the exposure as possible. And then a lot of it also is taking control of your thoughts and redirecting your thoughts, replacing, your thoughts with positive thoughts. And then sometimes many people require medications to help, at least for the short term, to help with smoking cessation, and a lot of support. So, some people can be successful just doing it all on their own, but majority of people need that support and information about quitting smoking. So one of the things I do with my patients is I send them texts like randomly, like, good job. I know it's really difficult, quitting. I'm so, and encourage them. And they really appreciate it, right? Because they know someone is out there rooting for them, and then I give them stats about how healthy their lungs are getting by quitting, how healthy their heart is getting, and things like that. So you can do so many different things to support your patients or to support people to quit smoking.
Well, let me ask you this. As you're supporting your patients, do you ever utilize like data from your phone or data from, they have these smart watches. Do you ever utilize that?
So there are some apps. There's a quit app that I will recommend patients to get as well, to help with smoking cessation. So there are many different things. Is that what you mean by data from the phone?
Yeah, because our phones, and they have like the Fitbits and the smartwatches, and not just for smoking. I'm talking about general health. They keep track of your steps, your sleep.
Oh,
Yeah. Do you ever
so
rely on those?
right. Not so much. I mean, I do have patients that will keep track of their health in that way and will bring me the data and I'll look at it. But for the most part, I don't really track that as much. I mean, most of the time, for example, if we wanted to make sure that their blood pressure is controlled, I'll have them buy, a quality blood pressure machine and teach them how to use it properly and all that kind of stuff. But yeah, no, I haven't really got, but I know those things can be helpful depending on the condition. And, if they have those statistics, I will look at them and see if we need to do anything with it.
Okay, yeah, because I see a lot of people. They're very common now, so I just wondered if they were something doctors were currently utilizing. But in my, go ahead, doctor.
No, go ahead.
No, I was gonna transition to my next question, which is that in my experience, doctors don't talk too much about nutrition with their patients. I think a lot of that may have to do with the fact that, again, the average doctor visit is only about 15 minutes. So you don't have a lot of time to get in depth with a person's lifestyle. But, since you're someone who practices lifestyle medicine, how important is the role of nutrition for good health? Because I want this to be cemented in the hearts and minds of the audience. And really, how do you advise your patients to eat? As in, do you have a particular diet that you prefer? Is there, there's all these diets out there, the carnivore diet, this, that. Do you have a particular diet that you recommend patients to, to adopt?
Sure. Yeah. So, we've talked about nutrition quite a bit, but the truth is there's so much to talk about. And a lot of doctors also, the truth is we don't get as much information as we would like in medical school about nutrition. So I think there is a knowledge gap there too. And, except you are getting additional training in it, it's difficult to know as much about it. And that's, I mean, general stuff, but to be able to go in depth, you would need additional training for most doctors. And in terms of how I talk to my patients, like, I don't like diet because, like, I wouldn't say a diet. It's more like, how you eat. I don't know the right word, but diets, there are just so many different ones. And the one way of eating that I think is the most beneficial for health is the whole food, plant-based diet, which is what I touched on earlier, where you're eating whole food, which means food that you can go outside, you can imagine going outside and getting. And so, and then mainly plants, like not, going at least as much as you can toward plant-based protein and minimizing protein from meats and especially red meat. So that will be the mode of eating that I will recommend. And then the other thing with nutrition is, people don't know that even how you prepare food does make a difference. Like if you're using a lot of dry heat, that's not the best way to prepare food. You want to eat more as raw if you can, and then boiling is better than frying or grilling or broiling or or frying. So basically how you prepare food can also make a difference. How you even eat makes a difference. Like, are you eating very quickly? And that way you don't know when to stop because you're not full. You don't give your body a chance to get full. So eating slowly and mindfully also makes a difference. And then when you eat also makes a difference. For example, if you try to eat most of your meals in a 12-hour window or even an 8-hour window, that actually gives your body the best opportunity to heal and repair.
Intermittent fasting, right?
Basically, yeah, intermittent fasting. So there are different things that are helpful when it comes to eating and nutrition that is very difficult to talk about in a 15-minute visit. So that's just what it comes down to. Yeah.
Well, thank you so much, Doctor, for enlightening us and just clarifying a lot of, really enlightening us with a lot of this wisdom that you shared. I think it's wonderful to hear a medical doctor, highlight the importance of nutrition, just even in your practice. I think what I've seen in my experience is, I guess maybe more so traditional doctors, they're sort of locked into a standard of care. But then when you see them outside of practice and you talk to them, they're like, yeah, plant-based is the way to go. But you don't have the time, and maybe you don't have the training to really guide a patient into that, that modality of eating, that way of eating. But it's wonderful to have, doctors come on and really reinforce this idea, because I think a lot of people have heard this, they've heard this, but maybe they've heard it from somebody on YouTube or on television, but it's, you have a physician that's actually encouraging you to play a greater role in your health. So I think that always does a whole lot of good for our people to see. So Dr. Ashaye, how can people get in touch with you? Are you on social media? If so, where?
Yes, I am on Instagram and Facebook at InTouch Primary, and also at life.stylemd. And I also have a YouTube channel, InTouch Primary Care. And for those in the Houston area, my website is intouchprimarycare.com. So those are the ways to get in touch with me.
Well, thank you so much, Doctor, for your time. Thank you so much for the information. We'll go ahead and post your social media information right in the chat, and encourage everybody to go and subscribe to your channel as well. And of course, when we publish this interview on my YouTube channel, Dr. Cedrick, we'll make sure we include all of that there, so that those who will come back in the future to watch this will have that information ready. So I want to give you the last word before we go into the Q&A. Do you have anything else that maybe you want to share with the audience?
Sure. Yeah. I just want to say, thank you for being here. And also you can do this. I always want to encourage people to try to just take small steps. Small steps make a big difference. So don't feel overwhelmed. There's always so much material, but it's really, really possible. Just the little things over a period of time actually goes a long way.
Amen. Dr. Ashaye, Dr. Lola Ashaye, thank you so much. Listen to the audio version of the Self-Care Forum podcast on Spotify, Apple, and Google Podcasts.